many different factors that affect whether or not you will bruise. So there's no definite yes or no answer that you're going to bruise from a certain product or procedure. The first thing that's going to affect whether or not you're going to bruise is the product being used. Botox and fillers are very different products. Botox is a water-based product, so it's very thin and it squirts very easily through a needle. So you can use a very small needle with Botox. But with fillers, since the product is a little bit thicker, you can't push it through a small needle. The pressure will build up and the needle will pop off. You have a little bit bigger of a needle and you have a little bit thicker of a product. So you are a little bit more likely to bruise when you're using a filler versus using Botox. The injection techniques are a little bit different. For the most part, with Botox, you're going straight in. With filler, you can be using the needle at an angle and interrupting a lot of tissue. And anytime you go through the tissue, you can interrupt capillaries, which is what causes a bruise.
Certain areas of the face are more likely to bruise. Depending on the product and technique used, these include the under eye area due to its vascularity and thinness of the skin. The lips, also due to their vascularity and thinness of the skin. Nasolabial folds due to technique and amount of product placed. And marionette lines, also due to technique and amount of product placed.
Certain medications are going to make you more likely to bruise. Aspirin, Motrin, Coumadin, these are all things that are going to thin your blood or make your blood less sticky so you don't clot as fast. I added alcohol here for the same reason. If you are drinking either within 24 hours or after 24 hours, you do thin your blood and you are more likely to bruise. Your nutritional state is going to affect whether or not you're going to bruise. If you are anemic, which means that your iron levels are low, you're more likely to bruise. Usually this can happen when you are menstruating, so it is usually a good idea not to get this stuff done if you have your period. It is also a little bit more painful during this time of the month, so just something else to look forward to. Bruising. Arnica montana is a natural homeopathic medication that you can buy at a GNC or a Whole Foods, and it helps with the bruising process. You can get it in a tablet or in a cream. Both are just as effective. Ice. After the procedure, you want to ice for 20 minutes on, 20 minutes off. Do not fall asleep with ice on your face. You can burn yourself, and this causes vasoconstriction of the vessels, so blood is less likely to leak into the interstitial, into the interstitial tissue. Avoiding alcohol. If you are going on a bender for some reason, like you just broke up with your boyfriend, it might not be the time to get your lips done. Or it might be the time because you can go on a bender, get your lips done, and get a new boyfriend because you look so hot. And you also want to avoid those other medications that I mentioned, ibuprofen, Motrin, aspirin, Coumadin. If you are on aspirin or Coumadin for your heart because a doctor told you to be on it, do not take yourself off without talking to that doctor. When it comes to Botox and fillers, bruising is always a possibility. So if you have some big event that you have to go to, like a wedding or a job interview, it's probably not the time to get your Botox and fillers. I say give it 2 weeks before a really big event, just for the worst possible scenario. Or, you can just make up some excuses. Some good ones I've heard: my husband, dog, son, kid, whatever beats me. That's always a really good one, but just be careful who your audience is on that one. You're going to the dentist, or you went to the dentist, had some dental work done, and remember, I have nothing against dentists, Colleen. Or you can just cover it up with makeup. My friend Sarah Victa did a very good makeup tutorial for me. You can check her out on YouTube at sarahvictor.com.